Hey, Dr. Vicky here. So I want to go over, so I went over the mechanism of getting Francesca's vision back. She was my patient that after a stroke, she got her vision back. So, and like I said in that video, it's not magic. So today I want to cover what is going on with I have several patients that have dementia. So I want to talk a little bit about that. So, and dementia can be an overall complete brain dysfunction, or it can be parts. It can be decay of the brain, basically. So pathways aren't working properly, and then you expect to see a lot of symptoms in regards to that. So what I like to do is to figure out what areas are significantly not damaged that I can use to drive the pathways that aren't working properly. So that can be hand-eye coordination. That can be, which goes through the balance center. I can use different types of exercise. I love exercise because it drives the brain at a really high rate as far as through the muscle system. So the muscle spindles, which are in the muscle, drive the brain at a really high rate. So you can start to see extreme changes in function after doing therapy. So I like to do, first I'd like to start off, and if we're going to do exercise or we're going to do hand-eye coordination, we're going to do any of those things, I'm going to start with that because I want to get those neurons ready to really capture as much as we can per session. And it's pretty remarkable, the cognitive things that can come after that. So, and it's not the same for everybody, and I use other pathways in conjunction. So I have a lot of different things that I'm doing at once. And so it's multimodal, where I'm doing a lot of things to drive those pathways. And it's you see pretty significant change, and the light goes on. And it's especially for like the spouse or family member that brings them in the first place, it's quite remarkable. So, and sometimes you have to get really creative as to what kinds of things you're going to do, and it doesn't always work, and you have to be able to pivot into other things if it doesn't work. So if you've got questions in regards to treatment for cognitive decline, give Souter Chiropractic a call, 303-385-3432.